Our next storyteller is joining us from Los Angeles, Kris Bennett. You're up.
Thank you. Um, I still remember walking into what felt like the most normal hospital. My mom checked in and went to the back. I sat in a pretty boring waiting area for what seemed like ever. I checked my phone, started to think about what I was going to do that night, and of course, started to think about what I was going to eat next. Finally, my mom emerged, gave me a half hearted smile, and spoke the words that no son ever expects their mother to hear. They found something, it's cancer. My heart sank. The world seemed to blur for a moment, which felt weird because I had just come back home from my first break from school. I was having a pretty successful basketball season so far, had all the confidence in the world that you would expect a starting freshman collegiate athlete to have, right? I mean, a few nights before that, I was quite literally sitting in my coach's office talking about the professional teams overseas and the NBA G League teams that were interested in me, and life felt right. But in that instant, I genuinely felt like a child again, felt like I had no control, helpless, terrified. My mom, the woman who had always been my anchor, was now the one who needed some grounding. But isn't a story just about her diagnosis. It's about what came next, what it really revealed about her, about myself, and about the system we all rely on when our health hangs in the balance. My mom was always very aware of the fact that she was lucky. She's a well educated, self aware white woman who had a really good career that offered her health insurance. We always lived in cities that had access to highly rated hospitals. If anybody was going to be able to navigate this and win this, and win kind of like the healthcare system successfully, it was going to be her. And yet, it was still a labyrinth. Appointments were confusing to schedule. Referrals felt like running in circles. One specialist sent her to another who needed paperwork from another. Oncologists spoke in jargon Latin terms, making decisions that felt impossibly high stakes without explanations we could fully understand. My sisters and I really leaned into each other during those long hours of research, trying to decode what was happening to her body and what treatment options were going to even be best for her. But even with all of her privileges, the barriers she faced were scary and plentiful. Mhm. Delays in approvals for scans, out of pocket costs that made her hesitate before saying yes to tests, the mental toll of constantly advocating for herself when she was already physically exhausted. I began to wonder if this is a reality for someone like her, what must it be like for folks that don't have the same resources? My mom's battle was not just with cancer, it was with a healthcare system that seemed to resist helping her at every single turn. And it wasn't just her fight. Every appointment and interaction unearthed some stories of others who were struggling harder. I remember sitting there and watching an uninsured woman in the waiting room with two small kids quietly crying as she had to review the bill that she got. There was a man who I remember getting his bill and getting information, and his English wasn't fluent. I remember sitting there listening to this Black family who had drove hours from the Inland Empire to Los Angeles because they didn't have the necessary technology at their center to be able to get the care that they needed. I couldn't stop thinking about those moments, couldn't stop thinking about those people. They stuck with me like glue, filling me with a restless energy that I really could not shake. Even as I sat with my mom during her treatment and was consumed with working of ways to find ways to be there for her, I couldn't ignore what I was seeing. It was impossible not to see how much easier our path was simply because of who she was, and I was way too aware to not be deeply disturbed by how unfair this was. My mom's journey, while in no way was easy, ended with a successful remission, and I will always be grateful for that. But this experience left me a mark on me, an awareness rather, that I honestly can never unsee. Her survival wasn't just about medicine or luck, it was about access. And I kept asking myself, what about everyone else? I started doing some research, I started really digging. I wanted to understand why these disparities even existed and why were they so pervasive. I all too fully understood and recognized racism as a young Black kid growing up in America, but I didn't understand how deeply ingrained these disparities were in all of our systems. Why were Black men more likely to die of prostate cancer than white men? Why did Latinas have lower rates of breast cancer but higher rates of dying from it? Why was the life expectancy of indigenous populations consistently lower than that of any other group? The answers were complex but undeniable. These outcomes weren't just the result of biology, they were results of policies, practices, and systems designed to exclude certain people, sometimes unintentionally, but other times intentionally.
Mhm.
Health outcomes were tied to income, education, race, gender, sexual preference, and geography in ways I'd never understood before, and I knew I couldn't just stand by. So after I finished playing professional basketball, threw myself into the world of health equity, really steep learning curve. I found myself surrounded by incredible advocates, brilliant researchers and mentors, and of course, community leaders who had been doing this work for decades. Wasn't sure where I fit in at first, but I kept going, digging it deeper and deeper. Today, my work is deeply tied to the values I learned during this time by my mom's side. I advocate for funding programs that ensure equitable access to screening and treatments. I push for policy changes and hold institutions accountable for disparities in care. I help design initiatives that center the voices of communities that are often ignored in conversations about health. Every project I take on, I see my mom's face. And I see the
Mm,
faces of those who sat in the waiting rooms with her,
yeah.
who didn't have the same privileges she had. That this work isn't easy and oftentimes feels thankless, but the systems we're trying to change are deeply entrenched with challenges and barriers, and progress can sometimes feel slow, and that's okay. And the one thing that I've learned about that is the smallest victories matter. A
Yes.
single grant program that funds screenings for an underserved neighborhood, a community-based cancer education initiative that reaches men of color who would have systemically been excluded if they didn't have this, or even a partnership that builds trust where none existed before. All of that matters. All of those are wins. So when I tell my mom about the work I do now, she always smiles. She always tells me she's proud of me and the type of work I've chosen to pursue. I've never fully thanked her for letting me be part of her journey. And I've never fully expressed how meaningful her experiences and bravery were and how they've helped shape my career. I don't think she sort of, I think she sort of understands the importance her journey has played on the work I do, but I don't think she fully has seen the complete impact of it. The strength to fight, the courage to confront injustice, and the belief that even the hardest battles are worth fighting all came from watching her navigate these situations. Her story became my story, and together we're part of something much bigger, a fight for health equity that's been long overdue. Thank you.
Go ahead, Jamie.
Thank you, Kris. I did not have the pleasure to meet Kris in LA this year, but I have worked with him in preparation for this event, and this story always just brings a huge smile to my face because I think it perfectly describes the challenges with healthcare. We can speak to the systemic issues that a lot of underserved or underinsured communities face, but this also highlights such a problem that heavily resourced communities still have some of the same, if not different, very different struggles with navigating our healthcare system. And I think that like the fire that it's sort of ignited within you is remarkable to see. It's what drives a lot of us in this field, and being able to tell her story in such a triumphant way, have turning such a negative experience into power, sort of reclaiming your power and making sure that, another woman, another man who do have access can navigate this system in a way that's impactful is great to see and a joy to watch. So thank you for your work. Thank you for sharing your work, showcasing your work, and really honoring your mom's story in a way that's so impactful.
Wow. And we can see as we hear you and watch you with your LA cap and your pictures behind you, we locate you, we say, this is a man of extraordinary courage. He could have gone on, probably become a coach. I don't know. Still in basketball? No. You responded to the injustice. It reached you and you answered. We will never forget this. You answered. Thank you.
Thank you.
Yeah, the chat echoes these our feelings as well. Kris, thank you. Such a powerful reminder that it's not just the patient that is impacted by an illness. And Martha shares and says, thank you for such an amazing story. And thank you for your vulnerability.
Hmm.